On behalf of my colleagues, I'm feeding back from the International Conference on Urban Health in Valencia. My name's Kate. I'm with the ARISE Consortium. So one of the main messages that came through was the need for a greater focus on urban health. So we heard that urban populations are growing and they will continue to grow. Dr. Tedros opened the conference by reminding us that by 2050, 70% of all the population will live in cities. And city life brings its own blessings and its challenges, and the blessings can be enhanced if we're knowledgeable and prepared. So many sessions in the conference challenged the idea of the urban advantage. At the panel on family planning, we heard that there's evidence of stalls and reversals in the fertility decline of some African cities. And this same disparity was echoed in presentations on women's mortality in India and under 5 health in Kenya. Many panels and presentations showed how the climate crisis is amplifying this urban health crisis. Our research, policy and programming must address the uniquely urban challenges that health systems face. Recognizing that urban health systems go far beyond the healthcare system is crucial for creating healthy cities. And within this, we must support urban residents to be at the forefront of making those cities healthy. Point number 2, and I'm sure you'll all agree with this one, there's a need for more and better data. Surveys are often partial, and we need more specificity, including on slums, and granularity to identify clusters of poor households within better off neighbourhoods too. In low and middle income countries, the private and informal healthcare sector is used by the majority of urban residents, particularly the low income households that we're so concerned with. And this needs to be brought into the public sector health information systems. And this data needs to be used by urban planners in the health sector. You know, data from across many different sectors can drive urban change, but data has to be open so that we can collectively discuss problems, devise actions, and hold public and private sectors to account. We heard critiques of the way that new technologies may endanger security and that they might be co-opted by capitalism over the community. The challenges of partnerships with big data firms and pharmaceutical companies was highlighted, while there was an acknowledgement that they too may be part of the solution. We heard a lot about interurban diversity. So we heard about neighborhoods and we heard about zip codes and postcodes and health outcomes, how they're so closely aligned. We also heard how people pass through and in and out of cities in the course of their days and lives, so they're not tethered to one place in particular always. We were reminded of those often invisible urban informal settlements that lie out of sight and often out of policymaker mind. And we also heard about diversity within urban informal settlements. And this points to the need for a more fine-grained socio-spatial analysis rather than making assumptions about slums in general. The focus on place building was a key theme in the conference, with many examples of communities coming together to shape and improve their own neighbourhoods and environments in the course of looking for better health. Equity and human rights. Understanding discrimination and inequity within cities is a prerequisite for healthy urban development. So in the panel on gender from Chorus, who are at this meeting, we heard about how health service availability, readiness and utilisation are all affected by gender norms and power relations. Often men control the household financial resources, whereas women perform the management of household health and that kind of decision-making. Chorus also found that norms in cities are changing, particularly as more women are working outside of the home. The Sister Project demonstrated both the systemic barriers to women's involvement in STEM and also strategies to overcome them. But we found ourselves asking, what of the women leaders in those low-income communities, because if leadership is predicated on a higher education, we're missing the talent of women who are already supporting their families and their communities, often in unpaid positions, although sometimes paid. And this includes community health workers, who are mentioned a lot during the conference as a critical cadre in the health system. These women are often the invisible engine of the health system and also of the city. Climate change and planetary health were massive issues here. So the determinants of climate change are in themselves a health hazard. Cars, environmental pollution, poor air quality. And some at the conference argued that we should be as familiar with the NDCs as the NCDs. Well, the NDCs are the nationally determined contributions and are at the heart of the Paris Agreement. So furthermore, in a panel of transforming urban environments, it was underlined that by 2050, more than 1 billion people will be displaced globally due to climate change and natural disasters, and they're mostly going to go to urban areas. And it really echoes presentations on how climate change already impacts the health of those people on an everyday basis, including informal workers in India and farmers in Zimbabwe. Dr. Funmi Adeniyi from Local Governments for Sustainability said, "Today's story is one of the tripartite burden of biodiversity loss, climate crisis, and disease, brought on by a multiplicity of factors: insatiable consumption, unsustainable production practices, i.e. business without ethos, disproportionate health, climate, and poverty burdens on particularly vulnerable populations." Unsurprisingly, multidisciplinary and multisectoral approaches were at the heart of the conference. So people's health in city is determined by the urban environment they live in. So housing, water, sanitation, transport, and the built environment must be health promoting and protecting across the life course, irrespective of gender, social characteristics. Many urban projects and studies presented at the conference showed how the greatest improvements of health occur when changes are made to the wider determinants, such as to transport, housing, and urban design. So the conference was characterized by a fine mix of disciplines. And this is particularly important given the ongoing fuel and climate crises that are affecting all of our cities. Systems approaches. So Blessing and Beru of APHRC made the point that tactical approaches that rely on bounded interventions neglect diverse actors and rest on flawed assumptions, because cities in themselves are actually complex adaptive systems, and seemingly beneficial changes in one sector can potentially have negative effects in another. For example, a reduction in cars means fewer traffic accidents, means lower harmful emissions, less noise, less air pollution. It's all good, right? However, it could also lead to unemployment among working class people reliant on the automobile industry. So it's clear that we need to take a systems-wide approach to ensuring that we do no harm. So mapping systems and their workings is a key element of urban health research. In the symposium, where you are, when we think of the required human resources for health, we should think how best to support decision makers from health and other sectors to use system thinking approaches to understand the interconnections and be forewarned of unintended consequences. Cities in emergencies, number 8. COVID threw a shadow over the conference. Many responded to the crisis and also researched the crisis. There's a lot to be learned. Dr. Mark Ho, Director, Contact Tracing and Epidemiology Centre in the Ministry of Health Singapore, argued that we must break the cycle of panic and then neglect. And I think that's a sentiment that could be put to many areas of urban health. So COVID-19 demanded rapid action across sectors and unprecedented coordination in cities. So it did bring innovations such as telemedicine at a faster rate. In the conference, there was talk of emergencies as windows of opportunity for citywide policy change. However, there was little mention of cities in perpetual crisis, such as those in fragile and conflict-affected settings, or of cities characterized by chronic states of crisis, such as the areas of cities where informal settlements lie. Further thought is needed on an emergency framing and how this relates to a long-term and sustainable response to health. Community leadership and voice, number 9. Kondaka Hazibul Kabir reminded us in plenary that working with the community and not just for the community is important. This was an important issue raised by those conducting participatory research. Yet at the conference, these voices were on the whole only heard through academic intermediaries. Also conspicuous by their absence were health workers. Yet health providers and public health teams need additional skills, particularly soft skills, to negotiate and influence multiple sectors and identify creative solutions responsive to the multiple and changing contexts of places within cities. They should be a centre point of research on health in urban areas, and they should be a centre point of our conferences. Finally, slide number 10. This one's on accountability with an image taken from my capital city of London. We heard from many mayors and global decision makers at the conference, which was refreshing and it was enlightening. Because to tackle urban health, we need strategies for multi-scalar policy influence and engagement. And this engagement deserves quite a critical eye, as local government may be heavily influenced by politicians, by private companies, by property developers, who are all powerful. And this can undermine long-term planning and sustainability. Furthermore, at the conference, there was little discussion of protest, of rude accountability and accountability from below. Despite a literature on how these methods are often the advocacy tactics of the poor and the dispossessed, when all other routes to accountability have been exhausted. So I do think that there is like a sound foundation for further thinking on these issues. So on behalf of all of my co-authors, I'd like to thank you for the time you've given us. I think the International Conference on Urban Health, it was really invigorating. It was really exciting. It showcased all that was cutting edge. I would really recommend that people either join the society or attend the conference in the future. And we welcome the opportunity to provide an update and look forward to working with you all as we move forward. And that's all from me. Thank you.